Welcome to the AIAMC podcast. I'm Kimberly Pierce Burke, your executive director, and I am so excited to have as our guests today two lovely ladies from our member JPS Health Network. We have Dr. Tricia Elliott, who's the Senior VP of Academic and Research Affairs, the Chief Academic Officer, the designated official, and I remembered all of that without looking at my notes, Tricia. That's a lot. And with her is Dr. Diana Singer, who is the Executive Director of Academic Affairs. And I've just so enjoyed getting to know these two exceptional people over the last several years. And we were sharing before we came onto the podcast of just the podcast that Tricia and Diana have done for us. And it's really fun to come full circle and give me this wonderful opportunity to chat with them about, drumroll please, JPS is the winner of the 2026 AIAMC Innovation Award. We give the Innovation Award once a year to our institutional member who best exemplifies creative and innovative approaches to medical education and research, which we believe will ultimately impact more positive patient outcomes. And be sure to stay with us till the end of the podcast because I have a few quick, personal fun fact questions to ask of Tricia and Diana. Um, but I will get started with you. Your project, your submission, I should say, for the Innovation Award is entitled SHINE, which is an acronym. We love those in graduate medical education. SHINE is Students in Healthcare for Individual Empowerment, a Workforce Pipeline for the Future. So I always like to start these conversations with the why. And this may seem terribly obvious because any of us in medical education know the need for a workforce pipeline and how important that is. But your approach, I found very interesting in that it's an immersive experience, paid internship, and high school students of all health for all health professions, not just necessarily grooming the next generation of physicians. So tell me the why behind that and how, why you chose this and why you chose the approach you did.
Well, first and foremost, Kimberly, it's an honor to be here. Thank you for the honor to be here and for the selection of our amazing program as the award winner. It's just truly an honor to be here and a great surprise. So, I'm going to start with the why. So, I'll say the why starts for me from a personal level, and this has been definitely, I feel like I'm living my why. So, actually seeing a dream come to fruition that I've had for many years and a passion around that, but it's also the why for JPS too, and why we're here in our community to serve our community and what we want for the future for not only our workforce, but for our community and those wonderful young folks coming through the pipeline to be able to see healthcare as an incredible career opportunity for them and to see that happen early. So my personal why has always been to inspire future generations to reach their highest potential and to be change agents in their own communities, and to be able to do that, to be able to transform the way that we deliver healthcare in our communities. And so for JPS, our mission is to transform healthcare delivery for the community we serve. And in doing that, we have to focus on our workforce and our future workforce. And so part of that is to engage our students along all the continuum of education, and the earlier the better. And so with this program, we were able to focus on our high school students. And we're going to tell you too, now we're also going to take that into the university level students too this year. So it's definitely for me just a joy to see this dream come to fruition. When I joined JPS many years ago, it was definitely part of our strategic vision here in academic and research affairs to be able to see a pipeline program and a pathway program develop. And it's definitely aligned with our JPS priorities around creating access, not only for our patients, but access for our communities to see healthcare and the way we deliver healthcare as a wonderful opportunity to care for our community. And I'll
Mm.
team to Diana because I know she shares some of that too.
I think that's
Well,
a great answer. We share the same why. I just remember at the Shine orientation was oh my gosh, we actually did this. Shine graduation, we were both, back in the back with tissues. It actually happened. And, we had multiple parents come up to us and just say, you've changed the trajectory of our children's lives. And
Yeah.
that is something that we don't take for granted. And we were like, we did it, like it happened. And so, yes, the why is definitely the same. And we always joke that had Shine existed when I was in high school, I would have been the first person to apply. And so I love to see that these kids are getting this exposure early, and it's so fun. We also started a second, or I guess a third program where we're going to bring back some of the original class as fellows in kind of a mentoring peer, support role. We kind of call them camp counselors, and we got to interview them last week. And so to hear what they've done in the 6 months since they've graduated, we were like, we've arrived. This is it. This is
Oh
like
my
just the
gosh.
joy in the future, and just to hear their excitement to join medicine and nursing and music therapy and every discipline, the things we didn't even we had to ask the music therapist, what degree do you even get for music therapy? And it's just so fun, and it's just so incredibly gratifying.
Wow. And just, I mean, I know some of our members will just be listening in to the podcast, others will be watching. But I know looking and watching your two faces as you talk just light up. And I hope those that are listening can just hear the passion and the excitement in your voices. And what a treat to have your personal passion and something that's so important to you be recognized and honored by JPS, be in alignment with the mission of the hospital. I mean, it's amazing. It's like I love it when all the pieces come together like that. Something else about your submission that I found fascinating and I think made it so award worthy is that I do think it's transportable. I mean, I do think that this great program you've come up with, we can share it with other AIAMC members. And of course, there will be tweaks and nuances, but this is something that really could take place somewhere else and have impact in other parts of the country. Um, you've described three pillars. There's experiential learning, professional development, and then certification. How did you land on those? And can you tell us a little bit more about each of them?
Sure. I'll start a little bit with the experiential and definitely why that was important. I mean, having an immersive experience where you're actually seeing the ins and outs of healthcare and what we do every day, I think it's critical. Because oftentimes when you have students, they come in, it feels that they're standing on the outside looking in. It's very much the observership model, right? And I think that was important for us to make sure that they were, no, you're going to be part of the healthcare team. And we want you not only, yes, to learn the different aspects and have that experience across the entire system, because that'll help inform too, like, oh, because some of them are already like, well, I thought I wanted to do this, but I got to see this and I really like that OR. I really like this. And you're able to see different roles in the healthcare team and I thought I wanted to do that, but now I might want to do this. So that experiential can be transformative for them, right? They can really help them to really pin down what they want to do. And I want to also tag into the experiential and why I love that you say that this can be also a model to be able to duplicate and really, see it in other systems too. And we're happy to share that. And that's what I really love this, is that there's also the part of it around making sure that this was a paid internship. We wanted them to feel value in terms of the commitment from an organization level is that you are really part of the team, just like everyone else, expected to show up, expected to clock in, expected to do this. But we value you as a health system. We value you as a team member in terms of that level of commitment. So
Mm,
I will just expect there's a lot of things that can be out there in terms of observership or unpaid or things like that. But we wanted to take that experiential level to the level of not only you're immersed into this, but we are committed to you from a pay level, from a level of the team expects you there, the patients are seeing you too as a team member, and we're really there. So that part I think was really important. I love to tag to Diana, of course, to talk a little bit about the certification and the other pillars of that, because that was also something of value that we wanted them to leave with.
Yeah, absolutely. The certification piece was we know our program is a little bit unique, and we're hopeful they were going to be very excited to enter healthcare after. And we wanted to give them that avenue just to have that smooth stepping stone into the next phase of their career. So even if they're still in high school, even if they're going into college, we wanted them to have that skill set, A, to put it on a resume, but B, it's, I mean, incredible how many of them are using those certifications, whether it's, a PRN position where they're doing phlebotomy, or, they're a patient care tech on the weekends or things like that. Just keeping those skills up was really, really important to us. And it also demonstrated the commitment, because they're not the hardest certifications, but they are not easy either. And to do it in 8 weeks really is an abbreviated stint to get these certifications. And so it really showed their commitment to having something they could walk away with, to say, not only am I a Shine graduate, but I'm a patient care technician, I'm a phlebotomist, I'm an EKG technician. And I will humble brag that the National Healthcare Association, who sponsors the certification, said they've never seen a 100% success rate in a group like that in such a consolidated timeline. And so I think that was, a huge indicator for us of, okay, we're doing this the right way, where we're balancing the curriculum, but also the clinical experience. And so, yeah, to see every single one of them graduate with that, if they're eligible, was just fantastic. And like I said, getting to it was really great timing that we got to talk with the graduates last week, and so many of them are using it. So that's not only just a checkbox, right? Not just going on a resume. And that leads me to the third pillar. That is something that Dr. Elliott and I were both very, very passionate about, was we wanted them to not only be great clinicians, but we want them to be very, very seasoned professionals. And so part of the curriculum was partnering with our just incredible team members and leaders in HR, and having a longitudinal HR curriculum. And so everything from how to build a resume, what is your LinkedIn profile? The greatest day ever was I didn't know exactly what course was happening what day, and all of a sudden I had 30 different LinkedIn invitations from the Shine interns. I was like, oh my God, they want to be my friend. And it was like to see, and it was, their job title is Shine Intern, and was just so exciting. And now we get to see what they're up to on LinkedIn. But it was also, how to show up to an interview and how to answer questions professionally, right? And so we joked it was a semi-adulting curriculum, but it was a big piece of it.
But I think a lot of adults we work with could benefit from such a program. Can I just say?
Isn't that the truth? And just to see, and I think, all the different things culminating together, but I think that was such a big win. There's one intern I can think of that her dad happens to be a physician here. And he said, she was so shy coming into it, wasn't sure. And she showed up to graduation, just stole all the energy in the room. And he's like, this is because of you guys. And we're like, no, I think this is because of HR. Just teaching how to present herself and the confidence and all those different pieces. And so that was such a rewarding part of the curriculum. And it's funny that our HR partners are already like, what are we doing? What's the plan? And I was like, wait, we gotta get some interviews done first. We gotta select some kids first. But we have so much excitement around that piece of it. And just to make sure that we're setting them up for success. And to your point earlier, Kimberly, we're not just grooming physicians or nurses. Like, they're going to go any which way. We have some that are interested in non-clinical routes. Mm-hmm. So one could argue that these skills are even going to be more important than other ones. And so I would argue that every kid, should have this training regardless of their career path. But that was just really kind of rounded out that holistic approach.
Absolutely. And we talk so much about interprofessional teaming and being part of a team, and you're walking that talk. You're looking at the whole team, which is just truly exceptional. You've alluded to this a little bit already, but like what's next and what you might do differently. You said you're going to have some of the grads come back as mentors, which I think is fantastic. But I want our listeners and viewers to know you had 600 students apply. 600. 30 were accepted, and all 30 graduated from the program. And so you've talked about sort of the tears in the back of the room at graduation and a little bit, but tell us what's next and what you might do differently in your second cohort.
Well, we had to start the interview season this year by reminding Dr. Elliott she cannot take them all. Every
I
interview
want them
day,
all, Kimberly. I
every
want them
I
all.
don't blame you.
every
This
single
is like I
interview.
am living like just like this is like just the best thing ever for me. Okay, I
Oh,
just love it. I
wonderful.
get to interview them, and I just get giddy with excitement.
Oh, that's wonderful.
Yeah, it's like, okay, we're gonna take 6. The first thing she says in the debrief, can we take 8? No. So I have to be the dream squasher to tell her we cannot. I wish we could, but we
Mm,
can't.
Okay.
But yes, I will say we had just a resounding response to applications again this year. So we'll take another 30 high schoolers, and then we're really, really excited to expand the collegiate program. We piloted it last year with one undergraduate college intern, and so we'll have 2 cohorts of what we have dubbed Shine U, was our way to kind of delineate those, and then of course the Shine Fellows
mm.
is going to be we're joking that our other manager, Dr. Chanley, who's really, really involved, the Shine U will be her ducklings and the fellows will be my ducklings, and Dr. Elliott gets all 30 high schoolers. But yeah, so we're excited to scale the program, and the
Yeah.
incredibly generous support for our community that showed up to fund it does not go unnoticed. And that was, I think, a really, really big indicator for us of our community sees the success in this, and they're just as invested as we are. And that is just such a driving force to see that success, that collaboration, that excitement. And it's honestly been a little overwhelming the last few weeks of the applications opening. Like it's just the onslaught now that people know about it. And our greatest
Yes.
ambassadors are, of course, our 30 graduates that
Yes.
have already come before, and will always be the inaugural class. But the buzz, it is shining bright.
Well, and I just love as independent academic medical centers, we tout ourselves as really being a part of our communities and partnering with our communities. And this is just, again, walking that talk, living such a great example of that, and working with your community, having their support. I mean, and you've mentioned all kinds of different disciplines in HR. And I mean, this is talk about a collaborative effort. I mean, just it's amazing. Kudos. So, well, I
Yeah, and
promise.
I want to throw in something here too, because I will tell you, I want to just really highlight the team though. The team has been an incredible team to help bring this to light. I appreciate, as Dinah alluded to, they entertain my crazy ideas. Oftentimes it's 3 a.m. in the morning. I wake up and I speak into my phone just to say, and so, and I come like, camp counselors, fine. Okay. I'm like, shine you. Okay. So, but they make it really look like light up, and then we figure out the logistics and operationalizing it, and they do an incredible job. But it's a true team effort. She mentioned Dr. Chanley. We've got a great coordinator, Julie Vasquez. All the people that do this work. It takes a team, and
Mhm.
so if there are others thinking about this, ensure that you invest in your team and you have the
Yes.
expertise in your team to help bring this to light and operationalize it, because it is crucial to make
Yes.
sure you see that happen. But I will say the other thing is, to the point of the community. Community is taking notice. I really thank our philanthropic donors that actually I had the opportunity to share the story with them. And it was just like, oh my gosh, yes, this is the why. And so as you'll see, if you look to our website, we've got our donors listed there, and we thank them for that, in addition to the investment that we have given from a JPS perspective. But we also have academic interest now, right? I'm not going to get into definitely details, but we have academic interest now to say, oh my goodness, y'all are doing this, and how are you doing it? And can we like figure out a way to partner
Can
with
you
you
hand them
on
right
this?
off to us?
Yeah.
You know, can we do some early pathway programs? Is this certification? Like, what are we thinking about here? So as we unfold this, more to come, where that's what I want to see. I want to
Wow.
get credit for this experience. Can we
Yes.
get credit? Can we move them into that a little bit
Yeah.
more, these pathways? So we really have that longitudinal continuum of experience and education and accreditation pieces with this.
Yes.
Them. So more to come on that, just for you to know where our brains are going, is that's what I
Yes.
want to also see happen in the future.
Well, thank you for that teaser, and you heard it here first. And my takeaway is you need the dreamers and the doers. You need
You do.
you need them. I mean that you can't pull this off without all of those skill sets. So, well, I promised at the top we'd learn a couple fun facts about you, special ladies. So we're
Oh.
going to do that now before we close. Um, this is a do you prefer question. So I'll start with Tricia. Do you prefer texting or talking?
Talking into her
Uh,
phone. She wants both.
I want both. Yeah, yeah, yeah. I do. I talk to text. That's my favorite thing is to talk to text. But I am not, it is not a problem for me to pick up that phone and to just say, hey, sometimes that voice to voice back and forth is just important for me. So, yes.
Yes, very good, very good. And Diana, do you prefer chocolate or gummies?
Gummies, absolutely. It is a a running joke of everybody has a candy kryptonite, whether they want to admit this or not. And so if you ever see hot tamales on my desk, that is an early warning sign.
Oh, okay.
If
Duly
I
noted.
have succumbed to hot tamales,
Look out.
yes.
And then she knows, then what's mine then, Diana?
The Sour Patch.
Sour Patch. Yes, Sour Patch.
Oh,
Watermelon Sour Patch.
Watermelon sour, very specifically watermelon.
I love it. All right. And then the next one is what is your favorite? Okay, your favorite. Tricia, what is your favorite season of the year and why?
Well, I will say, as an island girl, I should say summer, but I'm going to actually say fall. I love that change of season. I love the colors. I'm looking at that. The temperature is just right. Give me 65 to 70 and I'm good. But then give me a beach in the summer and I am thrilled. So
Gotcha. I'm actually a fall girl as well. You see my KPB for OSU sign up there. I'm all about college football and cool
yes,
temps and colors on the trees.
love it.
Diana's, your favorite holiday and why?
Oh, that's a hard one. I am notorious. Trish can back me up. If there is a holiday, we are going to celebrate
Oh yeah. Oh yeah.
it.
All of the above, I'll probably say for her.
Probably with matching t-shirts. Um, I really love Thanksgiving. I am also a fall girl. I feel like it's the kind of underappreciated holiday, but gratitude is just something that's so key to my life, and it's just a chance to pause kind of before the chaos of the Christmas season. And I just have fond memories of Thanksgiving. I celebrate family Thanksgiving with my best friend and her family, and it just brings me so much joy to see just people that you love and cherish around the table, but then also it just feels like there's a sense of gratitude in the greater community.
Absolutely. And what a perfect note to end our chat with because I am so grateful for the two of you. I am just so grateful how you live by example. I'm so grateful for JPS's membership in the AIAMC and your involvement and all you do and how generous you are with sharing great news and great work. So our sincere thanks to Doctors Elliott and Singer. We hope you'll join us in Carlsbad in April. April 17th is the awards dinner.
We'll
I
be
can't
there
wait to
in matching
present them.
shirts.
Yeah, maybe matching t-shirts. We may sing a song. You never know. I hope you've enjoyed listening or watching in on this podcast. And if you don't already, follow us on our social platforms, Facebook, Instagram, LinkedIn, and Blue Sky. I'm Kimberly Pierce Burke. Thank you again. Take good care. I can't find the stop record button. Mindy can fix this.
Mindy can edit up.
I'm serious. We're recording, right?
You are.
Yeah, click on more.